Hello, this is Rick again. In this set of video lectures, we'll be covering coding diseases of the ear and the mastoid process. Okay, these codes start from age 60 and go through age 95. And these include disorders and diseases of the external ear, the middle ear, otitis media comes to mind, the inner ear, and of course, any intraoperative or post-procedural complications. There are no specific chapter guidelines, so I can't tell you to follow along with the guidelines section in your text or review the front of chapter 8 because the guidelines have not been published. However, there are some instructional notes in the tabular that you need to pay special attention to. And these include such things as to use an external cause code following a code for an ear condition, if it's applicable to the cause of the ear condition. And there's a series of exclude to conditions, exclude to again meaning that you can code it for another related condition if the documentation supports it. And of course, we want to, as we've seen in other chapters, code first associated conditions and to use the additional codes as we're told to in the tabular. And one thing very important that people seem to forget all the time is to use additional codes to identify exposure to tobacco smoke, tobacco dependence, and tobacco use. This chapter covers all different types of diseases and disorders to the ear and the mastoid process. And this includes infections, any inflammation, lesions, obstruction, hearing loss, and everything else. It may be helpful to review figure 11.1 in the text. For codes age 60 through 62, these cover diseases and disorders of the external ear. The external ear being the outer ear, the auricle, and the external acoustic meatus that is the auditory canal and goes all the way into the eardrum. Otitis externa is an infection of the external auditory canal. In other words, that is in front of or towards the outside of the eardrum. And we commonly refer to this as swimmer's ear. And its acute form, it can be pain, fever. We can get cellulitis, some sort of partial hearing loss if it's bad enough. And again, since we have two ears, we're going to want to make sure that we pick up whether it's right, left, bilateral, or unspecified. We have subcategories H62.4 and H62.8 that require the reporting of the underlying disease that caused the external ear condition. We will see these code first underlying condition notes in the tabular. So this would include any possible cause such as impetigo and others. With the code categories H65 through H75, we're now moving into the middle ear. In other words, those that are past the eardrum. We would use any additional code for any associated perforated tympanic membrane, another way of saying the eardrum, that's included with otitis media codes. And of course, as we've seen with others, at the outer ear disorders, we want to use additional codes for exposure to smoke, personal use of tobacco, and so on. Otitis media is the inflammation of the middle ear, and we have it described as acute serious otitis media, other acute non-suppurative otitis media, other chronic non-suppurative otitis media, acute suppurative otitis media, and other chronic. And again, these codes will all have laterality, meaning that they will either be right, left, bilateral, or unspecified ears. Eustachian salpingitis and obstruction. This is the acute and chronic infection of the eustachian tube that connects from the ear to the roof of the mouth. And it's any type of obstruction. This is the eustachian tube, and the inflammation is in fact referred to as salpingitis, not to be confused with the reproductive tract. Mastoiditis and related conditions, can have acute chronic petrositis and also a left and a right for mastoiditis. The H70 code is the mastoiditis, and what this is basically some sort of infection resulting in inflammation in the mastoid bones. And as a result, we have pain, fever, conductive hearing loss, and so on. Chronic mastoiditis occurs with chronic suppurative otitis media. And basically, we have these growths in the lining of the middle ear, and this changes the function of the ear. This will ultimately result in a hearing loss. The most common microorganisms that we see are strep, the flu viruses, group A strep, gram-negative, and Staph aureus. With the perforation of the eardrum, we can have it ruptured from several causes, right? It could be the result of an injury, infection, inflammation, and of course, when we're using this code H72 for the perforation of the eardrum, we're also going to code any associated otitis media from the age 65 through 67 codes. And this is mentioned in the tabular. Otosclerosis, H80, is basically the growth of spongy bone in the inner ear where it doesn't belong, and it causes obstruction. And again, we see this sometimes in middle-aged women, and ultimately, if it doesn't get treated, it will result in hearing loss. Meniere's disease is basically this inner ear condition. It can start off being described as vertigo, the ringing in the ear, the balance, the congestion in one ear, usually on one side, right? Sometimes we see it documented as idiopathic endolymphatic or labyrinth hydrops, although Meniere's disease is the more common form of it. The dash after H81.0 is for, you guessed it, left, right, bilateral, unspecified. And of course, more diseases of the inner ear. The most common one is the vertigo, where that kind of swirling feeling. Sometimes we can not find this. Dizziness is different than vertigo. Dizziness is a sensation of unsteadiness. Vertigo is that more severe whirling feeling that we see. It's coded to the H81.1 code category. Of course, the dash meaning left, right, bilateral, or unspecified. Hearing loss is coded to code categories H93, H91, and several different types of hearing loss, right? So important to read what follows and surrounds terms like hearing loss, deafness, what have you. And we can have sensorineural hearing loss, which is basically a defect in the sensory mechanisms that connect to the auditory nerves. These are coded again to H90 and H91. And again, another one global term that we see is hearing loss, and it could be unilateral, it could be mixed conductive and sensorineural, it could be bilateral, and could be described as deaf non-speaking. So this is when somebody not only can't hear but can't speak. So important to read the documentation carefully. And then finally, we have the post-procedural complications. And we see some of these here: intraoperative hemorrhage, hematoma, accidental puncture, and so on. And that's all I have for you. Please stop by office hours if you have any other questions about this material. Bye now.